Epilepsy, otherwise we call them as fits, seizures. Near about 12 million people in India are suffering from epilepsy. The global prevalence is around 15 million people. Nobody knows how it is causing. Even the science is totally astonished to trace out the real reasons of epilepsy. But still there are certain hypotheses. For example, whenever our brain is producing lot of electricity, all our activities are governed by our brain by means of a controlled electricity. If it is becoming excess, then we will suffer from fits or epilepsy. This is one among the several accepted theory behind the epilepsy. But this is not 100% true, because there are several medications nowadays to treat the epilepsy with this principle and some other principles. But still 30% and above epilepsies are not controlled by any sort of medicines. So there are several reasons for that. There are even the brain tumor, it can cause epilepsy, and even without any reason, traceable reason, there are several cases of epilepsy. The whole scientific people is wondering how it can be controlled nowadays. And it needs medication, no doubt, under the supervision of a experienced neurologist. But still, it needs a lot of other therapies to control the incidents or the fresh episodes of epilepsy. Out of which, being an Ayurveda doctor, I can say lot of scope for the treatment in Ayurveda, like Panchakarma treatment and medicines. Our Ayurveda treatment is mainly aims, number one, to control the epilepsy without medicines, without allopathic medication. There are certain cases in which, along with allopathic medication, we need to take Ayurveda medicine to reduce the dose of epilepsy medications. Otherwise, how much duration the medication has to be continued, that can be reduced substantially by Ayurveda treatment along with this allopathic medication. And of course, almost all the allopathic medications against this epilepsy is having a lot of complications, side effects. To reduce that, we can have Ayurveda treatment. And there are certain epilepsies, if we are not taking allopathic medication, it will be severe. If we are taking allopathic medicine, the severity will be reduced, but epilepsy will not be stopped. In such condition, if you are consulting a perfect, experienced Ayurveda doctor, you will get control over the total epilepsies along with this modern medicine. And in Ayurveda, not only the medicines which are giving the results, but according to the individual who are suffering from this issue, we can customize their food, their lifestyles from bed to bed, how to bath, how to take exercise, and what are the type of other activities like day-to-day regimens that has to be followed to control the epilepsies. These are the scope of Ayurveda medications. Of course, the Panchakarma like Shirodhara, Panchakarma like Nasya, and Panchakarma like several other procedure-based therapies can contribute a lot to control or to stop the issues of fits. So be wiseful to make the decision not only to control the epilepsy, but to improve the quality of life of that individual. That is very important. Thank you.